Good day. Hello, I'm Mitzi Joy GAGTO. So we are the first year students of the University of the Cordillera, Baguio City from the College of Accountancy. So as for this time, we are here to present to you our research study, which is entitled Psychological Impact of COVID-19 Pandemic on Students and Faculty. So this study is conducted by our faculty of our students of fellows accountancy students of here in the University of Cordilleras while coping up to the pandemic COVID-19 this third trimester of school year 2019-2020, and also as for requirement for our subject is statistical analysis with software application this third trimester. So first, let's hear our abstract.
Thank you for being here today. I am Ria Gayle M, and I'm here to talk to you about the abstract of our study. A novel coronavirus or COVID-19 pandemic has been spreading in the Philippines and other parts of the world since December 2019. The pandemic has brought not only the risk of death from infection but also unbearable psychological pressure. Hence, the objective of this study is to evaluate the mental situation of college students during the pandemic and to provide a theoretical basis for psychological interventions with college students. Therefore, the accountancy students enrolled in the third trimester in the University of the Cordilleras were investigated and analyzed concerning their mental health status. The research was conducted during academic year 2019-2020 with 282 students. Second is to evaluate if there's a significant difference in the level of anxiety among 6 variables, namely course, number of semesters enrolled, region, family income, living with parents, and relative or acquaintance got COVID-19. And lastly, if there's a relationship between the level of anxiety of students and the variable scores and number of semesters enrolled. The data collected was statistically organized and analyzed with the use of SPSS or Statistical Package for the Social Sciences. The results display that the total average of the level of anxiety is 11.085, which indicates that accountancy students are mostly have a moderate anxiety level. It also shows that the 6 variables have a significant difference in terms in the level of anxiety of the accountancy students. In addition, the 2 variable scores and number of semesters enrolled shows a relationship with the level of anxiety. There are recommendations to administrators, students, and future researchers, which includes, number 1, the school administrators are encouraged to identify students who are at risk for mental health problems and or suicidal behavior, as well as to promote emotional health awareness among those people who interact with students, most frequently from faculty members to other students. Another help students and another recommendations. Number 2, to lessen the number of students suffering from mental health problems, the university's Guidance and Counseling Office can conduct a monthly evaluation of the students who have higher risk on having psychological disorder and or conduct events that can ease the student's mind, such as webinars on how to cope with these problems during pandemics.
So, hi, I'm Abegail Jay F, and I'm about to present a short overview of the Chapter 1 background of the study. So, the novel coronavirus, COVID-19, has spread very rapidly all over Philippines and several countries, causing an outbreak of acute infectious pneumonia. So, last December 2019, when the first official case of COVID-19, a disease caused by a novel coronavirus called SARS-CoV-2, was detected and confirmed in Wuhan City in the Hubei province of China. Just a few months after the first infection, the number of COVID-19 cases outside of China has increased drastically, and the sustained risk of global spread prompted the World Health Organization to declare the COVID-19 disease as a pandemic in March 2020. As of April 2020, from the Center for Systems Science and Engineering of the Johns Hopkins University indicates that the virus has infected at least 1,935,646 people from 185 countries and has killed 120,914 individuals. Among the infected, Italy has recorded the highest number of casualties with a total of 20,465 deaths, followed by Spain with 18,056 deaths, and lastly France with 14,967 deaths. While the highest number of recoveries is number 1 China with 78,195 recoveries, followed by Germany with 68,200 and Spain with 67,504. The COVID-19 pandemic has presented to us the numerous vulnerabilities within our healthcare system, with public health response, the Philippine government, and general public. So the pandemic brought not only risk of death from the viral infection, but also the unbearable psychological pressure to people. With the rapid spread of pandemic around the world, people express panic in various behavior. It affects the economy of the country, social values, and psychological stress of people involved, regardless of the direct contact with the infected. There was also reports on the psychological impact of pandemic on general public, patients, medical staff, children, and older adults. Because of the vulnerability even in school settings, thousands of schools closures are implemented the world overdue to COVID-19. As of April 6, 2020, UNESCO reported that there has been 1,576,021,818 affected learners out of 91.3% total enrolled learners in 188 countries in all levels of learning. In the Philippines, due to the 4,195 confirmed cases as of April 10, 2020, based on the Department of Health online tracker report, the COVID-19 pandemic really causes a massive impact in higher education institutions. So Philippines opted into online learning. Some teachers recorded and uploaded their lessons online for the students to access, and some were even more innovative by the use of Google Classroom or WebQuest. After 3 days of National Memorandum for Alternative Delivery, Commission on Higher Education suspended online classes due to the increase of students and teachers who appealed to the online mode of learning. The continuous spread of the pandemic, strict isolation measures, and delays in starting school, colleges, and universities across the country is expected to influence the mental health of college students. So, according to recent studies, COVID-19 has an association between educational levels and anxiety and depression levels. Anxiety levels are also significantly higher in people with at least one family member or relative with COVID-19 disease. University of Bristol also shows young people's anxiety levels have doubled during COVID-19 pandemic, with 24% experiencing anxiety up to 13% in pre-pandemic waves. So the COVID-19 pandemic is an evolving global crisis, and there is much that is still emerging in terms of the psychosocial and mental health consequence of the diverse population affected by the emergency. Methods of guiding students to effectively and appropriately regulate their emotion during public health emergencies and avoid losses caused by crises. Crisis events have become an urgent problem for colleges and universities. Therefore, we investigated and analyzed the mental health status of the accountancy students of the University of the Cordillera for the purpose to evaluate the mental situation of college students during the pandemic and to increase one's self-awareness to the accountancy students by taking self-assessment to take immediate intervention and habitual coping strategies.
Hi, I'm Lizytte Daphe TOLITO, and I'm about to present the paradigm of the study, which will now present the independent variable and the dependent variables of this study. Independent variable includes the factors that affect the level of anxiety. First is the course taken by the respondent, which could either be BSA, Bachelor of Science in Accountancy, BSFMA, Bachelor of Science in Financial Management Accounting, BSMA, Bachelor of Science in Management Accounting, BSAT, or Bachelor of Science in Accounting Technology, BSAIS, or Bachelor of Science in Accounting Information System. And lastly, BSFRA, or Bachelor of Science in Forensic Accounting. Next among the factors is the number of semesters enrolled, wherein this includes semesters during first year for the higher years. Next is region, which could either be CAR, Region 1, Region 2, NCR, and the likes. Next is the family income, specifically the perceived family income, which could either be very low, low, high, and very high. Next is answering the question, are you living with the parents, by answering a yes or no. And lastly, answering the question, do you have a relative or acquaintance who got COVID-19, which could either be answered a yes or a no. Next is the dependent variable of the study, which is the level of anxiety. Through the Generalized Anxiety Disorder 7 scale, the respondent could either have a normal anxiety or moderate anxiety, mild anxiety, moderate anxiety, or severe anxiety. The GAD-7 score is calculated by assigning scores of 0, 1, 2, and 3 to the response categories of not at all, several days, more than half the days, and nearly every day respectively, and then adding together the scores for the 7 questions. GAD-7 total score for the 7 items ranges from 0 to 21. 0 to 4 range would mean a normal anxiety. 5 to 9 would mean mild anxiety. 10 to 15 is moderate anxiety. 15 to 21 range is severe anxiety. Later on, after identifying the level of anxiety of the students, we correlated to two among the factors, which is scores and the number of semesters enrolled. So that is the paradigm of the study.
Hello, I'm Joyce MONFORTE, and I'll be presenting our research paper's methodology. In this chapter presents the methodology and procedures the researchers used to implement and complete the study. It contains research design, population of locally of the study, data collection, instrument, data collection procedure, and treatment of data. The research design. The research design was designed to understand the relationship of the related stressors of anxiety level of accountancy students. Under descriptive research design adopted due to the nature of the study that uses collection, presentation, and description of data in order to answer a question. According to the study 2018, it deposits the participants in an accurate way by observational case study and through survey. Descriptive correlational. Descriptive correlational design is used in this study because the researchers sought to describe and correlate the level of anxiety and related profiles of course, numbers of semesters enrolled of the respondents, the population, and locally of the study. based on purposive sampling technique that alternative use of probability is not considered due to quarantine as response to COVID-19 pandemic. The target population of the research are the College of Accountancy students in University of the Cordillera. It was stimulated along 282 out of 918 who are enrolled in Bachelor of Science in Accountancy, BSA, Bachelor of Science in Accounting Information System, BSAIS, Bachelor of Science in Forensic Accounting, BSFRA, Bachelor of Science in Management Accounting, BSMA, and Bachelor of Science in Financial Management Accounting, BSFMA. In third semester during the academic year 2019 to 2020. The first table presents the population of the respondents. Yeah, nasan yung first table? Yeah. The table 1 presents the population of respondents from first year to fourth year under the College of Accountancy courses with subtotal of 419 first year, 399 second year, 79 third year, and 21 fourth year. The table 2 represents the profile of the respondents. In their demographic profile, according to the region, number of semesters enrolled, course, year level, living with the parents, family income, relative or acquaintance got COVID-19, place of residence has active or no active cases. Purposive sampling was employed by the researchers in obtaining the respondents that participate in the study. Since the following criteria were provided, first should be the student of University of the Cordillera, and second, they must currently enroll in third semester. Due to COVID-19 pandemic and community quarantine, the researchers were not able to conduct the traditional survey. The online survey was conducted in the population of accountancy students in University of the Cordilleras as the location of the study. University of the Cordilleras, UC formerly known as Baguio Colleges Foundation, BCF, is a private university located in Baguio City, Philippines, founded on June 19, 1946 by attorney Benjamin R. Salvosa and his wife Evangelina D. Salvosa. Reported by the University of the Cordilleras, supported by the University of the Cordilleras Libraries, mission to support the teaching, learning, research, and community extensions programs of the university. The university started online classes last June 2020 as an advantage of researchers to conduct online survey and asked by the support of the admin in gathering data in the university. Data collection and procedure. After determining the respondents in the study, the researchers' questionnaires was made digitally as online survey using Google Forms due to quarantine implement in the survey was administered in the 5th week of July using social media platforms, especially Messenger to the respondents, as increasing amount of communicative activity takes place through this new medium of advantage, access to individuals in distant location at convenience of having data collection through online. As Oregon 2012, past decades have seen tremendous increase of internet usage and computer-mediated communication. After the respondents completed answering the questionnaires, the researchers gathered the score of anxiety as the study tends to gather the level of anxiety of the chosen students. Following the guidelines of General Anxiety Disorder 7, GAD-7, as it was completed, researchers will represent and identify if there is a significant difference of the respondents' level of anxiety as to their demographic profile.
Hello, I'm Valerie C, and I will be discussing the data collection instrument and the treatment of the data. For data collection instrument, the data gathering instrument used to gather the data were questionnaires using Google Forms. The questionnaires were based from related researchers and was composed of two parts: the respondents' demographic profile and the students' level of anxiety using the GAD-7 scale or the General Anxiety Disorder 7 scale. Of the data, the descriptive measures utilized to address the problem and objectives were frequency count, ranking, percentage, and weighted average, or weighted means. The gathered data were processed using SPSS Statistics version 17.0. Weighted average is used to measure the respondent's level of anxiety, while t-test, a type of inferential statistics used to determine if there is a significant difference between two groups of means. For example, is GAD-7 have significant difference on whether or not the student is living with their parents? On the other hand, ANOVA test or analysis of variance is used to determine if there is a significant difference between GAD-7 and the course, region, semesters enrolled, and family income of the respondents. The Pearson's correlation coefficient is a type of statistics that test that measures the statistical relationship or association between the means of three or more groups. In this research, it is used to determine the correlation of the respondents' level of anxiety and the number of semesters they enrolled. While contingency coefficients or Pearson's C is used to determine the extent of relationship between the respondents' scores and their level of anxiety. Ria, next. Ria, next. To determine the level of anxiety, it is calculated by assigning scores of 0, 1, 2, and 3 to the respondents category. As said before, GAD-7 total scores for the 7 items ranges from 0 to 21. Normal anxiety, 0 to 4. Mild anxiety, 5, 7 to 9. Moderate anxiety, 10 to 14. And severe anxiety, 15 to 21. And to determine the strength of or degree of the relationship of the respondent's level of anxiety and related stressors, it is based on the following ranges of the correlation coefficient. 1. Perfect relationship, positive negative 0.90 to positive or negative 0.99, very strong or very high. 0.70 to 0.89 is strong or high. 0.4 to 0.69, moderate or substantial. 0.20 to 0.30, weak or small. 0.1 to 0.19, almost negligible. And 0 for no correlation.
So as the result of the first problem of the study, which is the average level of anxiety of the accountancy students, the average level of the accountancy students mean is that there is a total average of 11.85, which is in the range of moderately anxious using the scale of general anxiety disorder 7. So this indicates that the accountancy students of the University of the Cordilleras are moderately anxious in relation to their demographic profile together with their circumstances which are related to COVID-19 pandemic. So to support this claim, according to Muhammad Salman et al., they concluded in their cross-sectional study that they conducted that the situation where the changes in daily life due to the ongoing pandemic is the reason why there's a distrust of the students of the four Pakistani higher education institution. So here we can conclude from the gathered data of the psychological well-being of the students of the University of Cordillera that students of the University of Cordillera that they're still in the process of coping up from the changes brought by this pandemic.
Statement of the problem 2 states, is there a significant difference in the level of anxiety of the accountancy students based on the following variable. So the findings shows that all the variables have significant difference in the anxiety level of accountancy students. First is scores, which is supported by the t-test 18.979 greater than 1.968 with a probability value of 0.000 less than 0.05 with a confidence interval of 95%. So this is also supported by the study of Charles Malgui entitled Determinants of Accounting Anxiety in Business Students, which shows that the anxiety increases as the year level increases. So senior years are more dominant in anxiety than the freshmen. Next is the number of semesters enrolled. It also shows that there is a significant difference in the level of anxiety of the accountancy students, which supports by the t-test 15.732 is greater than 1.968 with a probability value of 0.000 less than 0.05 with a confidence interval of 95%. It is also supported by the study of Charles Malgui, which states that the more accounting course taken by the students, the more anxious they become. So the freshmen or first year, wherein they have 3 semesters, are still have low anxiety level unlike the senior years with more number of semesters. Next is region. So region is also supported by the t-test, which result 31.274 greater than 1.968 with a probability value of 0.000 less than 0.05 with a confidence interval of 95%. So the study of Reem Al-Harbi, Khalid Al-Suhaibani, Abdullah Al-Marshad, and Abdullah Hamid Al-Yaya with the study depression and anxiety among high school students at Qasim region shows that the place of residence or region can affect the level of anxiety of the students. In the study, it shows that students living in Boraida were dominantly higher in depression compared to the other places. Next is family income. So family income also shows a significant difference in the level of anxiety of the accountancy students. It is supported by the t-test 28.707 greater than 1.968 with a probability value of 0.000 less than 0.05 with a confidence interval of 95%. Next is the living with parents. So living with parents is also supported by the t-test 30.255 greater than 1.968 with a probability value of 0.000 less than 0.05 with a confidence interval of 95%. So the two variables family income and living with parents is supported by the study of Wen Jun Kao and Jan Zung, which indicates 0.9% of the respondents were experiencing severe anxiety and 2.7% has moderate anxiety, and lastly is 21.3% with mild anxiety with the factors income stability and living with parents. And lastly, relative or acquaintance got COVID. So it has also significant difference in terms with the level of anxiety of the accountancy students. It is supported with the t-test 32.794 greater than 1.968 with the probability value of 0.000 less than 0.05 with a confidence interval of 95%. So it is also supported with the preprint server for health, which shows that those having a family member, friend, or acquaintance got COVID had significantly higher anxiety scores. So to sum it up all, the six variables have significantly difference in the level of anxiety of the accountancy students.
The statement problem number 3 of the study states, is there a relationship between the level of anxiety and the variable scores and the number of semesters enrolled? Through the use of the SPSS, the researchers found out that there is no significant relationship between the level of anxiety, both to the variable scores and the number of semesters enrolled. It can be gleaned from the SPSS result, a Pearson product correlation of 0.13 with significance levels of 0.826, which shows an insignificant level of correlation between the two variables. This indicates that there is a slight relationship between the psychological impact of COVID-19 and the course of the students. In contrast, this also means that the course of the students does not influence their level of anxiety from the COVID-19 pandemic. A previous research has indicated that most students majoring in introductory accounting have many negative, stereotypical perception of this course, often created or reinforced by accounting sources, lie in the definition of accounting itself. The definition provided by Warren, Reeve, and Duchek in 2007 is given as an example. An information system that provides reports to stakeholders about the economic activities and conditions of a business. Such definition represent or present accounting as a boring, pencil-pushing subject which causes anxiety for both teachers and students. This indirectly implies to the result of this study that the anxiety experienced by accountancy student was not affected by the course major they are currently enrolled in. Next is the relationship between the level of anxiety and the number of semesters enrolled. From the SPSS results, the Pearson correlation coefficient showed a value of negative 0.011, which indicates a not significant relationship with significance levels of 0.855. Several studies contradicted. For example, a study in Harvard Medical School in 2019 can be gleaned from its result that the sharpest increase in anxiety occurs during the initial transition to college. The study demonstrated that psychological distress among college students, that is, their levels of anxiety, depression, and stress, rises steadily during the first semester of college and remains elevated throughout the second semester. This suggests that the first year of college is an especially high-risk time for the onset of worsening of anxiety. When students can't manage their firsts, they're more likely to struggle. If students do not feel adequate or prepared to cope with the new environment of college campus, they could easily become susceptible to depression and anxiety. That was according to Harrison Davis, PhD, Assistant Professor of Counseling and Coordinator of the Community Counseling Master's Program. Feelings of inadequacy can stem from academic stressors, which now include the increase in educational level in college or the number of semesters enrolled in college. That was the statement problem number 3.
That concludes our research paper, Psychological Impact of COVID-19 Pandemic to the Accountancy Students of University of Cordillera. Thank you for listening and watching.